Delays are a growing issue across the state as more people wait to get their COVID-19 test results. News 19's Tai Wong explains what DHEC is doing about this issue as hospitals are filling up.
We continue to be on this roller coaster that we call COVID as our numbers continue to climb that slope.
Dr. Steve Shelton is the incident commander for Prisma Health in the Midlands. He says infections continue to climb across the state.
DHEC is reporting record numbers of 68,000 patients over the past 4 days.
With increasing numbers of people getting exposed, testing is also on the rise.
Enormous numbers of people seeking testing, roughly 4 times the number that we're getting PCR testing this time last year.
Public Health Director Dr. Brandon Traxler explains staff members at their dying testing vendors are facing staffing shortages, causing a delay in processing results. She adds the agency is working to ensure labs are returning tests back within 2 to 3 days.
We're exploring all avenues to redirect tests from labs that cannot result within that required 48-hour time frame to labs that can do so.
Dr. Traxler says the agency is also discussing the continuation with current partnerships that can't handle the demand. In response to the growing delays, DHEC says it recommends finish what would have been your isolation time or return to work if it's been more than 5 days.
There is emerging data that even after 5 days, between 30 to 50% of people will have some virus enough to infect others.
Prisma Health Infectious Disease Dr. Divya Ahuja says after 5 days, it's important to keep wearing your mask. Reporting in Columbia, Tai Wong, News 19 WLTX.
DHEC tells News 19 all labs are experiencing delays, but the main concern is with the Premier Laboratory in Greenville, and more schools across the state are moving to virtual learning because of the increasing number of quarantines and isolations within the school. Today, DHEC updated their guidance. Staff must test negative on day 5 after exposure and wear a mask for 10 days. Dr. Brandon Traxler explained how this data will be shared with parents.
Our local epidemiologists that are out there, health departments regionally, work with the school districts to make sure that they know when somebody's isolation or quarantine should end, and that criteria or that specific date is then put in that letter. If you look at it, you'll see there's spaces for that to be filled in. In those letters, that communication is what's sent to the parents or guardians of the students.
Traxler, I should say, added that data in the state shows the vast majority of COVID cases occur outside of schools. This morning, DHEC updated cases of COVID-19 in our state, the agency confirming 10,744 new cases of the virus and 14 additional deaths from COVID complications. The positive rate is 33.4%. As COVID cases increase, the number of patients hospitalized has spiked as well. Today, Prisma Health officials updated the impact of the Omicron variant surge on their staff and patients. Doctors talked about the increase in common factor with many of these patients.
Currently this morning within Prisma Health, we have 647 COVID positive patients within our enterprise system throughout the state. That does not include the 105 patients that are currently non-infectious who have completed a course of treatment for COVID but continue to remain in the hospital requiring some of that long-term treatment for these individuals.
Prisma doctors say that while Omicron cases are trending downward in some parts of the country, we have not reached our peak here in South Carolina.